Thank you, Ambassador Bato, for welcoming me to this very nice interview. My name is Dr. Omary Chillo, and I'm the president of Tanzania Health Summit. I would like to ask you a few questions with regard to participation of USAID and its partners like PEPFAR, CDC, and the rest on their participation to Tanzania Health Summit.
One of the things that a summit like the Tanzania Health Summit does is it provides opportunity for the implementing partners for PEPFAR administrative base to engage in direct conversation, not joined or called by PEPFAR or by any other partners themselves. But when you have a group like the Tanzania Health Summit calling everybody together, it provides a forum for open discussion, an opportunity to talk about the issues that we face in PEPFAR, the issues of health in general, and HIV/AIDS. So the opportunity for discussion, and also it increases the visibility of what we do with PEPFAR. It creates an opportunity for more people to accept and receive the work that we do. So it provides great advancements in terms of discussion, in terms of acceptance, in terms of visibility. Tanzania represents one of the largest PEPFAR programs that we have. And I often remind people that one of the reasons that Tanzania is such a great beneficiary of the program is because of the personal friendship between President Kikwete and President George W. Bush, who started PEPFAR. So ever since its inception, there has been a collaborative relationship between the U.S. and Tanzania. But the program has been going on for 20 years. Now, any program like PEPFAR cannot go on forever. But it's important for countries like Tanzania to recognize that at some point, Tanzania is going to have to carry the burden. So for Tanzania to carry the burden, it's going to take organizations like your organizations like some of the implementing partners that had been funded by PEPFAR, to find alternative means of support so that we don't reach 95 and then run out of money and then there's a reversal. The countries have to be prepared for that possibility. And the only way to be prepared for that possibility is to find alternative sources of funding. So what the Health Forum does, the Health Summit does, it allows us to have open conversation. Now we do know for absolute certainty that the funding for PEPFAR is still going to be around in the short term. We also know with absolute certainty that it is not going to be around in the long term. So that's why sustainability becomes the focus, and the Health Summit helps us talk about sustainability in a way that gives the country and the organizations in the country the opportunity to be able to strengthen their systems to continue to address HIV/AIDS. Public-private partnership, meaning that the government agencies, private industry, as well as private philanthropic organizations have to be tapped to see the urgency, to see the need, so that they can support continuation. An organization like the Tanzania Health Summit is going to require some elements of public funding, which means that the ministries of health are going to have to increase their budgets. It also means that you're going to have to go outside of government to find private partners through industry and through philanthropy. And I would also encourage you to seek private partnership through some of the universities, because very often universities have access to funding for summits like your summit that can allow them to continue. And the universities also have a wide range of experts who can contribute to the continuation of the work of the Health Summit. So we congratulate you for what you're doing and look forward to your work continuing while PEPFAR is in existence and long after PEPFAR is no longer in existence.